My first two projects that got NIH funding had to do with bone fragility and bone strength. And they were both centered around the proximal femur. So this was all about hip fractures and different ways to try and predict people who were maybe very fragile as opposed to those who could probably hit the floor several times and not worry. This project I'm involved in that I'm excited about, I'm working with a group at UCLA, and we're trying to get a better handle on radiation exposure in individual subjects. Right now, we kind of do what's called a whole body estimate. So whether you get your head scanned or your feet scanned, we kind of figure out what the whole body equivalent exposure level would be, which is very easy for the radiologist to understand because it's one number. And they're starting to get a feel for that one number and kind of what that might mean long-term risk-wise. But on an individual subject basis, it's not terribly helpful to have this one number because one day you may come in for a head scan because you bumped your head in a car accident, and you might come in a year later with severe belly pain and they might be worried about appendicitis, and then you might have something else go wrong with your knees, for example. And you'd have these sort of three numbers that might be added up but really wouldn't reflect any particular organ. Compare that to someone who has kidney stones, for example, who gets a lot of scans in the same area over and over. That one whole number is probably going to underestimate what's going on, at least in that part of the body. So this project that I'm involved in with UCLA, we're trying to come up with a way to predict organ dose values so that if you had your head scanned, we could start keeping track of what the dose was to your eyes. That turns out to be the hardest or the most sensitive part of your head. Brains are not very sensitive to radiation, as it turns out. That old commercial, this is your brain on drugs with the frying eggs, doesn't apply to radiation at all. Brain's actually very insensitive, but eyes are sensitive, and thyroid in the neck is also sensitive. So if you had a lot of head scans, that would be one thing. If you had a lot of chest scans where maybe your breast tissue was exposed, we're starting to get a lot more concerned about long-term risk of breast tissue. So we're just hoping to be able to do a much more personalized job of tracking radiation dose levels long-term. The ultimate goal would be to be able to follow someone long-term and really keep a close eye on accumulated organ dose levels. This would assume that you got all your scans at the same place, which doesn't happen very often in this country. In other countries with nationalized health care, they're already doing stuff like this. They're tracking at least the number of exams that an individual has over their lifetime. Even doing something simple like that is hard in this healthcare system because people so frequently switch and move and are referred to different places. And it's just, there is no sort of national database to track a lot of that stuff.